Welcome to the Health, Balance, and Wellness channel, your oasis of peace. Today, many people with diabetes mistakenly believe that taking medications or simply reducing their carbohydrate intake will solve the problem. Unfortunately, the reality is much more complex. Diabetes management isn't limited to eliminating certain foods or administering medications. There are key elements that must be present in adequate amounts in the body for insulin to function properly and blood sugar levels to be well regulated. Specifically, there are 3 essential minerals the body needs to maintain blood sugar balance. These minerals support the proper functioning of insulin and help those living with diabetes better manage their symptoms and improve their overall health. If you frequently experience widespread muscle pain, chronic fatigue, mood swings, or notice that your blood sugar levels fluctuate excessively despite medication, a deficiency in these minerals may be causing the problem. Magnesium, the forgotten regulator. The first essential mineral for diabetics is magnesium. Many people, even while taking anti-diabetic medications, continue to experience significant swings in blood sugar. This happens because the body often loses magnesium through urine, a fairly common condition among diabetics. When this happens, every single cell in our body struggles to respond to insulin signals. This results in the hormone's reduced effectiveness in lowering blood sugar levels. Signs of a possible magnesium deficiency include persistent fatigue, even after seemingly adequate sleep. Nighttime cramps, especially in the feet and legs. Tingling and burning in the extremities, which may resemble diabetic neuropathy. Anxiety, nervousness, insomnia, and difficulty relaxing. Arterial stiffness, which can contribute to elevated blood pressure. Blurred vision, which can aggravate diabetes-related eye problems. It's no surprise that a magnesium deficiency can cause so many different ailments. This mineral is involved in over 500 metabolic reactions, including those responsible for the production of energy, ATP, by cells. How can we replenish it? Magnesium is found naturally in numerous foods. The most suitable are pumpkin seeds. Just 30 grams can cover 40% of your daily requirement. Cooked spinach, 1 serving provides a significant amount of magnesium. Almonds, a 30-gram snack provides about a third of your daily needs. Avocado, 1 medium-sized fruit covers 15% of your daily intake. Dark chocolate, good news for those with a sweet tooth, it contains good amounts of magnesium. If you have trouble meeting your dietary needs, you can resort to using supplements, but it's important to avoid doing it yourself, as incorrect use can cause side effects such as temporary diarrhea. Beware of foods that inhibit it. Some substances hinder magnesium absorption or increase its excretion, such as energy drinks. Excessive caffeine, it's best to limit yourself to 1 to 2 cups a day. Alcohol, avoid completely, if possible. Zinc, pancreatic support. The second key mineral for blood sugar control is zinc. This element plays a direct role in the production and release of insulin by the pancreas. Although the body requires modest amounts, about 15 milligrams per day, a deficiency can have significant effects. In addition to promoting pancreatic function, zinc has antioxidant properties, fights oxidative stress due to high blood sugar and strengthens the immune system. Signs of deficiency. Slow healing of wounds. Alteration of smell and taste. Brittle nails and hair. Intestinal disorders, such as diarrhea and irritable bowel syndrome. Increased vulnerability to infections. Unstable mood, apathy, and in male cases, a drop in testosterone. Useful foods. Pumpkin seeds, 15% of your daily requirement in just one handful. Chickpeas, best soaked to reduce phytates, which limit zinc absorption. Legumes and whole grains. Again, if your diet isn't enough, you can consider supplements, but always under medical supervision, because excessive doses can interfere with the absorption of copper, another essential mineral. What to avoid? Diets rich in simple sugars. Excess calcium. Alcohol, it is best to replace it with drinks rich in vitamin C, which promotes the absorption of zinc. Chromium, the forgotten ally of blood sugar. Chromium is often overlooked, but it plays a crucial role in helping insulin do its job, increasing cellular sensitivity to the hormone. It's especially helpful for those with diabetes or who are overweight. The body needs small amounts of chromium, but the problem is that it is easily lost in urine, especially when blood sugar levels are high. How to recognize a deficiency? Unexplained tiredness. Uncontrollable craving for sweet foods. In more severe cases, anxiety, depression, tingling in the extremities. High cholesterol, chromium can help regulate it. Recommended food sources. Broccoli, ideal for integrating chromium and other beneficial nutrients. Brazil nuts, also rich in selenium, but should be consumed in moderation. Apples, contain small amounts, useful for glycemic balance. Even for chromium, it's important to avoid random supplementation. Before taking any supplement, it's essential to have blood tests and consult a healthcare professional to determine the most appropriate strategy. In conclusion, managing diabetes isn't just about limiting sugar intake or taking medication. It's crucial to recognize the importance of certain minerals, often overlooked but absolutely essential for proper insulin function and blood sugar control. Magnesium, zinc, and chromium are valuable allies in your diet. Including the right foods in your daily diet and correcting any deficiencies can make a difference in your quality of life and diabetes management. Before making significant changes to your diet or resorting to supplements, however, the advice is always the same: talk to your doctor, get tested, and work with him to decide on the best course of action for you. Please note that this video is for informational purposes only and should not replace medical advice. If you have any questions, please contact your doctor. If you like our videos, please leave a like and subscribe to our channel so you don't miss any upcoming content. See you in the next video.